Hi everyone, my name is Chelsea, and for my research question I addressed, in pregnant women at risk of preterm birth, does antenatal corticosteroid therapy versus no antenatal corticosteroid therapy decrease adverse neonatal respiratory outcomes? In Canada, 1 in 10 neonates are born premature, and this is a rate that has steadily increased by 20% over the past 2 decades. Of these neonates that are born premature, up to a third are at risk of developing serious respiratory complications, which are the primary cause of early morbidity and mortality. Corticosteroids are medicines that can be given to mothers who present with preterm labor to accelerate fetal lung maturation and prevent adverse neonatal respiratory complications. The issue is that 1 in 5 neonates are not administered corticosteroids. Healthcare professionals are missing opportunities for administration due to a lack of experience and/or comfort level in determining the eligibility of patients and timing of administration. On an appraisal of the best available evidence from 2 randomized control trials and 3 systematic reviews, I found that corticosteroids are highly effective for decreasing adverse neonatal respiratory outcomes. 4 of these studies were conducted in hospital settings of high-income countries, which makes it locally applicable to AHS. For my intervention, I would like to implement quality improvement strategies to optimize the use of corticosteroids in all prenatal care sites and delivery sites in Alberta. Regional presentations will be conducted on a preterm labor assessment algorithm to assist healthcare professionals in determining the timing of administration and eligibility of patients, as well as standardized order sets will be available on the electronic health record throughout AHS to prevent missed administration. Here is the algorithm that I would like to implement. Multiple studies have successfully implemented the QI strategies to optimize the use of corticosteroids. One includes a California initiative that found increased rates of administration of corticosteroids from 76% to 86%. Facilitators of the QI intervention is that it fits with AHS's existing guideline on the administration of corticosteroids. In terms of barriers, healthcare professionals may have lack of time to participate in educational presentations. Strategies to ensure adherence are providing interactive presentations that will be flexible around busy work schedules of healthcare professionals. As well, I like to designate an opinion leader that will motivate and inspire the change. To measure adherence, I'd like to conduct a prevalence study to determine the number of eligible mothers receiving antenatal corticosteroids and determine the impact of corticosteroids on neonatal respiratory outcomes. Outcomes to consider are monitoring the change in rates of neonatal respiratory mortality and morbidity. As well, it's important to monitor the change in rates of NICU admissions for respiratory complications of not receiving corticosteroids. Thank you so much for listening.